Well, thank you guys for joining. Sorry about the volume interruption. We are talking about things that we do not want you to do at home. And to start off, the number one thing that our veterinarians here at the hospital have said that they wish people would stop doing is actually giving human medications to their pets. And so a lot of people will say, hey, it's safe for me, we're about the same size, maybe I'll give a half dose to my dog, but unfortunately dogs and cats have very different metabolisms of these drugs, different toxicity levels as well, so you have to be really, really careful with the types of drugs and the dosages that you are giving to your dogs and cats. A lot of times we do give and prescribe human drugs, but sometimes the dosing is different. So to highlight this, a really common, unfortunate example of this is actually Tylenol or acetaminophen. Some, very, very safe for us to take. A lot of people take it all the time, but is actually extremely liver toxic to dogs and very, very toxic to cats. It can harm their red blood cells, and even just one pill can cause fatality in a cat. Another highlight of how the metabolism can be so different between animals and people is a common medication with thyroid medication. Dogs actually need about 10 times the dose as people do with their thyroid medication. So I think that really shows how different these drugs can interact in these species. So always, I'm always happy to talk with my clients if they want to try a human drug because it worked on them for their allergies or something. But all it takes is a phone call, an email to your veterinarian, and just ask them, hey, is this okay? What are the potential side effects? Is this okay to give in my current drug regimen too? Are there any drug interactions? So always talk to your veterinarian first about giving any sort of human drugs. And a lot of times you can, and they'll give you the right dose and the right amount to give. The other thing that pops up a lot on the internet is hydrogen peroxide to induce vomiting in dogs. And there are good doses of hydrogen peroxide out there that can work. It's something that we don't really recommend, and there's a lot of reasons for this. So one is that we have better ways to induce vomiting. So hydrogen peroxide actually irritates the esophagus and it irritates the stomach, and that irritation leads to them to vomit. We have something here in the hospital called apomorphine, which actually causes the nausea center in the brain to get activated, and that's what induces vomiting. And then we can counteract that with an anti-vomiting agent called Serenia, so they're not constantly vomiting. So it's nice to give them something that's not going to physically irritate, the esophagus and the stomach. The main reason not to do it at home is because you're likely not going to know the indications, and also vomiting is not benign, so it can cause aspiration pneumonia. And one of the problems is sometimes we're inducing vomiting and we want to, but there's such a high risk of aspiration pneumonia that we can't. And a classic example of this is a dog that has eaten something that has caused neurological signs. It doesn't have a gag reflex, and if you make that dog vomit, it's going to get aspiration pneumonia. So we've actually seen cases of this where people have made their dog vomit at home, and they didn't even need to. They got aspiration pneumonia. Now the dog's in the hospital for 5 days with that, and it wasn't even indicated to make that patient vomit in the first place. So there are also things that we don't want for them to vomit up. So caustic substances, it's better to let stay in the gastrointestinal tract. And sometimes you don't even need to do it. It depends on doses of poisonous substance they ate. So again, all it takes is a call to your veterinarian to see what to do. The only time where I would recommend to use hydrogen peroxide is if you're 2-3 hours out of the way, we've eaten something really, really dangerous like rat bait, and in those cases, that's probably your best resort at that point. But in my years of working ER, which wasn't very long, 2-3 years, I've never had to recommend hydrogen peroxide to be used at home. So again, it's best to stay away from that. It's not necessarily the hydrogen peroxide that can cause problems, although it is irritating and can, if you use a lot of it, cause ulcerations. It's more that indication for vomiting and also the risk of aspiration and these contraindications that we're talking about. The other thing with hydrogen peroxide that I see a lot in the dermatology world is people applying it to skin, which is fine for intact skin, but if you're applying it to a wound, Again, hydrogen peroxide is irritating. You're actually killing the skin cells, the epidermis and the dermal cells that are underneath that top layer of skin called the stratum corneum. So it's not recommended in those cases either. Yeah, we use it all the time in the hospital on intact skin, but not for a wound area. So those are kind of the top things, and then we're going to just go into some other kind of more unusual types of things to talk about. And again, I feel like the owners, we always have the best intentions, and it's good to get these things, out in the public because everyone hears so many different things about what to do. So another thing that we often see owners doing at home with the best intentions is using dental scaling devices on dogs' teeth at home. And so the purpose of scaling is to remove plaque, and it's to remove the plaque that's underneath the gingiva. I can tell you, you can't do that in an awake dog. It's impossible to get under that gingiva. So basically, you're scaling the visible part of the tooth, which isn't doing much for your pet. It's just causing a lot of kind of, why are you even doing this in the first place with your pet? They're probably not going to like it. And also, if that pet moves just a little bit, there's a really big risk that you may actually lacerate the gums. And we've seen that with scaling devices too. So we kind of see the worst of the worst from these, and that's why we recommend not to do it. Going on to kind of the surgical side of things, one thing that we don't see that often, and you may not have seen it in your dog or cat, but strings coming out of the butt, don't pull those. So the strings, oftentimes when the dog or cat eats a string, it can cause what we call a linear foreign body. And what happens with that is the string actually gets embedded into the intestines and anchors there. And then the string's passing through the whole intestine. And if you pull on that, it's actually like, almost think about it as a big block of cheese and a wire and pulling through that cheese. And that is not good on the intestines. So sometimes they can be removed that way safely when the intestines relax under anesthesia. Sometimes they'll come out, but oftentimes it's a very, it needs surgery, and you actually need to go in there and remove the piece that it's embedded in, and figure out where it's anchored. And there's one question or comment.
We do. It is from Shanna, and she is asking, what are the best chew toys for dogs who are anxious and chew through ropes? And then it comes out the other end.
Oh gosh. Yeah, unfortunately that's always going to be a problem. Sometimes I like to use, and it's messy, but just using like a raw sweet potato, because it doesn't really, they can chew on it for a while, and it doesn't matter if they eat the whole thing, it's going to get digested. So that's an idea for there, but gosh, yeah, that's a hard place to be if your dog is chewing on everything. I've been there before myself, and there's really not a good solution for that. Another thing that we've seen is people trying to bandage their own pets. Most of the time, people are bandaging and not applying the appropriate bandage materials. Most bandages, there are different types of bandages for different types of things. It's usually a 4-layer bandage. And a lot of times owners will apply them and get pressure sores in different places, and they're doing more harm than good. I actually have heard a case, actually it was Dr. Dujo, he's seen a case where an owner applied a bandage to all the good intentions, applied it too tight, didn't recognize the signs of a tight bandage, and unfortunately the whole leg had to be amputated because of it. So bandaging can be super, super dangerous if you don't know what you're doing. All right, moving on to some of the dermatology stuff. So something that I see from my clients that I wish they wouldn't do would be making their own concoctions and putting them in, particularly the ears. So I don't think people realize what a sensitive structure the ear is. Even our ear medications have a very small percent, a 0.1% chance of causing ototoxicity. And those medications, of course, are formulated very carefully to limit that risk. And so I've had owners make very strange things with oil and vinegar and rosemary. It sounds like a salad dressing, and they're sticking that in the ear. And so yeah, it's probably antiseptic, but we don't know, what it can be doing to the eardrum and to the inner ear in particular, and causing ototoxicity and deafness. So that's why we make ear medications and ear formulations, so we get them tested and make sure they're as safe as possible for our dogs and cats. The other thing I wish people would know about is to be gentle with bathing. So especially in the short-coated dogs, like bulldogs, and kind of that coarse hair, what can happen when you bathe harshly is that those hair follicles can get jammed back. The hair can get jammed back in the hair follicles and it create a lot of inflammation. And that can cause something called post-grooming furunculosis. And if you look that up, it's really, really terrible. It goes away really fast with the appropriate treatment, but it can be severely painful, severely itchy. And then it's a simple solution is just don't bathe as aggressively. The final thing I'll talk about are raw diets. I'll end on the most controversial subject for all of us. A lot of people seem to be very, very opinionated about raw diets. I'm really not, but I always want people to know the risks associated with the raw diets while they're feeding them, if they choose to feed them, and know what are the potential benefits of the raw diet. So I can say in the literature, there's really no good studies that can highlight any benefit from a raw diet versus a fully cooked diet. With that said, I can say in the literature that there are risks for the raw food diet. So when you think about raw food, a good majority of it, 50% of it, has something like E. coli or salmonella on it. That's why we're so careful with our raw food in the kitchen. Dogs can handle that bacteria a lot better than people. And so most of the time you can feed a raw diet to a dog and they don't get diarrhea or anything like that. They're not affected by it. But the problem comes from the exposure to the people. So now you have a dog that's eating raw food, it's on their mouth, they're licking you. It also gets shed in the feces as well. That's been documented, that they have a higher rate of shedding these pathogenic bacteria like salmonella. So there is a risk associated with it, especially towards the people. I think it's important to recognize that risk and to take proper precautions. I think it's also important to recognize that if you're feeding a raw food diet for your dog and there's somebody who's elderly or has cancer going through chemotherapy and is immunocompromised, it's probably not the best choice. That's one of the reasons why guide dogs are usually limited to feeding a raw food diet, because they just have more bacteria that they're shedding, these pathogenic organisms. All right, we've got one comment.
We do. We have a question from Irene, and she is asking, what about grain-free? Is this dangerous?
Is it what?
Is it dangerous?
Yeah, so I'll check out the Facebook Live on grain-free diets too. We did a whole episode on that. And so the grain-free diets, we don't know the link between grain-free, and the big thing was with cardiomyopathy. So my thing about grain-free diets is if there's no reason to feed it, you probably shouldn't be feeding it. And from the veterinary side, dermatology side with allergies, recommending grain-free diets, it didn't come from veterinary medicine. It was a marketing ploy. So again, if there's no reason to feed it, no reason to give it, we're still doing research between that association with grain-free and cardiomyopathy. Another question?
Yes, we have a diet question from Becky. She has said, my dog developed acid reflux and we have her on a low-fat diet. Are there chews you recommend?
I'd have to get back to you on that one. That's a good question for our internist. So, yeah, we can get back to you on that. All right. Well, if you guys don't have any questions, I hope, again, this wasn't about saying, please, don't do this, don't do that, but it's always, everyone has the best intentions at home for their pets, but I always think it's good to get out, some information from the medical side to make sure that we don't fall into these pitfalls and get these complications that unfortunately we do see. So appreciate your feedback on this video. If you liked it, please give it a thumbs up. We'll be here in 2 weeks again at 4 p.m. Thanks for joining.